Autism. Self-discipline is a skill that most autistic children have trouble acquiring. This includes not only inappropriate outbursts, but also habits that can be potentially dangerous, such as being aggressive towards others or causing harm to themselves, such as banging their heads off walls. To prevent these and other behaviors, one technique parents and educators can use to control autistic tendencies is self-management. Giving the child power over him or herself is often the key to keeping control over violent situations and may be a positive step towards learning other behaviors as well. Self-management works because the child is no longer fully controlled by others. By teaching self-management during specific times of day, such as while the child is at school or therapy, the child will be more likely to continue to practicing self-control during all times of the day. The key is to implement a program in which he or she monitors his or her own behavior and activities. Begin with short amounts of time, and continue to monitor the child from a more passive standpoint. Every 10 to 15 minutes remind the child that he or she is in control and needs to monitor and be aware of good and bad behavior. This monitoring is a form of self-evaluation. When a child is in control, he or she may think more closely about behavior in the past and present. Set clear goals with the child, for example, an afternoon with no aggression towards others or a day at school with no self-injury. Every 15 minutes ask the child how he or she is doing. Is the goal being met? If the answer is no, perhaps the child is not ready for self-management, or perhaps the goals are too unattainable. You want to make sure that the goals are easy to reach at first, and then move the child towards more difficult goals in the future. When a child is successful at self-monitoring, he or she will have a more positive attitude towards the experience. Of course, an important part of self-management is a reward system. Have the child come up with his or her own reward, depending on interest. Reinforcement will make these good behavior goals more clearly marked in the child's mind, and by choosing and rewarding him or herself, the child will feel completely in control of the self-management system. Choose simple rewards to start, such as smiley faces for every goal met and sad faces for every goal not met, and work up to a larger goal, such as a special activity or new toy when a certain amount of smiley faces has been attained. These types of programs do not develop overnight, so it is important that you and the child have enough time to devote to a self-management experience. By reinforcing good behavior with rewards, as determined by the child instead of by an adult, he or she will be more likely to carry this on even when not participating in the program. If your autistic child is mature enough, this could be a good treatment program to try. Busting the autism stereotypes. As with anyone with a physical or mental disorder, autistic people deal with a wide range of reactions from others, from full support to uncaring ignorance. Unfortunately, even those who support autistic family members, co-workers, and friends may not understand autism very well. This leads to stereotypes, which can result in hatred, embarrassment, or other unhappy situations. By becoming educated about autism, you can help others in your community cope with this disorder. It is most important to note that not all autistic people are the same. Other diseases and disorders have their own sets of rules, but autism is such a complex medical condition, that everyone reacts differently to it. Autistic people are usually rated on a functional scale, with high-functioning people being able to hold jobs and low-functioning people needing 24-hour-a-day care. Symptoms include behavioral challenges, uncontrollable movements, speech and communication difficulties, and emotional inadequacies. Some show all symptoms, while others show few, and still others may have most under control to the point where you cannot tell they have autism at all. Because every person is different, no one thing can be said about autism and be true overall. However, most autistic people have trouble communicating emotions. This does not mean that an autistic person does not feel. He or she simply cannot express this feeling. It also does not mean strong relationship bonds are not possible. On the contrary, many autistic people are happily married and in love. Forming relationships is more difficult for most, but can be accomplished over time. Many people believe that being autistic coincides with being a genius in some aspect. While it is true that some autistic individuals have extraordinary math, music, and art skills, this number is nowhere near the majority. In fact, relatively few autistic people function outside of the normal range in any skill. This stereotype is perpetuated in the movies and on television, because the story of a talented person fighting disadvantages, such as autism, makes a good plot. However, this is not the norm, so nothing more than the best they can personally do should be expected from an autistic person. However, it is important to note that autism is not a form of mental retardation. Some autistic people are mentally retarded as well, but most are not and should not be treated as such. In the end, the most important lesson to take away from your studies on autism is one of tolerance. You will probably need to be patient when dealing with autistic people, but by understanding a little more about the disorder, perhaps this will be easier. Learn what you can and spread the knowledge to those you know to help create a more tolerant setting for autistic individuals in your community. Can autism be cured? This is a question that every parent of an autistic child will ask at some point. The answer is no. There is no cure for autism. While you may see ads for books, or products that promise a cure for autism, they are misleading you. Autism has no cure. There are lots of treatments that can make living with autism easier. Here are some of the treatments that help with autism. Therapies. There are several types of therapies that can help with the treatment of autism. Occupational, physical, behavioral, speech, music, sensory, drug, play, and many other types of therapy can make a big difference in the life of an autistic child. The therapies will not cure your child's autism. They will just help teach them different ways of coping with it. Alternative treatments. Natural and alternative treatments are on the rise. These can include the use of herbs instead of prescription medications. The herbs do not have the side effects found in traditional medicines. Vitamin and mineral supplements are being found to help in treating autism. Always notify the doctor of any natural products you are using with your child. Some herbs can have interactions with prescription medications. Remember again, these herbs and vitamins are not cures. They are just to help with some of the symptoms of autism. Nutritional methods. Some people turn to the diet when treating autism. They eliminate certain foods that could cause sensitivities. Some of the foods they remove from the diet are gluten, dairy, and artificial dyes. The idea behind this method is that removing the foods that cause sensitivities will remove the behavior problems. You can have your child tested for food allergies. Ask your child's doctor about allergy testing. This will let you know if your child could be having behaviors due to a food allergy. It will also give you an idea of which foods to eliminate from their diet. There is no cure for autism, but there are lots of treatments that can help with some of the symptoms. When trying a new treatment, only try one at a time. This will let you know if it is helping or not. Allow enough time for the treatment to work. Usually 2 or 3 months is enough time to tell if a new treatment is working. There will be no miracle treatments that give immediate results. If you are using a herbal or vitamin treatment, inform the doctor. They need to be aware of the things you are trying. Herbs and vitamins can cause reactions with other medicines. It is important that the treatment team be kept informed and on the same page. This will make your child's outcome a more positive one. Do not waste your money on products that claim to cure autism. If there was a cure available, it would be told to you by your doctor, instead of some guy on a late-night infomercial. Continue to help your child by treating the symptoms of autism. This will help your child have a better life. Thanks for watching. Please don't forget to click like and subscribe for more videos. Thank you.